So, good day, ma'am, sir. I am Bernice Jason Botes, student nurse from Pamantasan ng Luzon, Pasig, and today I'll be assessing the breast and the axillary lymph nodes. So, for this assessment, I'll be needing some alcohol examination gloves, ruler, and if necessary, I will also use a pen light. So, proceeding the patient. So, good day, sir. I am Bernice Jason Botes, student nurse po from Pamantasan ng Luzon, Pasig, and today po, I'll be assessing your breast area and the axillary lymph nodes. So sir, before we proceed sa pinaka-assessment, kunin ko lang po yung name, age, plus birthday po.
Brent Justin Bote, 18 years old, February 8, 2008.
Tingnan lang po na ID band for verification. So, Brent Bote, 18 years old, February 8, 2008. Tama po. So, closing the curtains for client's privacy and hand hiding. So, sir, before po tayo mag-proceed sa pinaka-assessment, I'll be just asking po mga simple question para po makuha yung inyong health history regarding po sa breast area. So, may recent experience po ba ng pain around breast area?
Wala.
Any medication po that you're taking?
Wala.
Minom po ba kayo?
Hindi.
Meron po ba kumain ng mga fatty foods?
Hindi rin.
So, if the patient is a female, I have to ask if they experience any tenderness or pain around their breast during their menstruation. I also have to ask them their menstruation before the age of 12, a menopause for older women after the age of 55, and pregnancy after 30. I also have to ask them if they use some oral contraceptives. And then after having the preliminary questioning with the patient, I have to proceed now with the inspection of the breast skin for its discoloration or hyperpigmentation, and if there's any also retraction or skin dimpling or some localized swelling or edema. And while inspecting that, I will also inspect for its size, shape, and symmetry. So for the retraction, to emphasize the retraction, I have to ask the patient to raise their arms, to push their hands with their elbows flexed, and I also have to ask them to put their hands on their hips. Sir, okay. So sir, pwede niyo po bang itaas yung kamay? Then sir, paki-press po ng fingers ay nung kamay po. Then last sir, pakalagay po ng kamay sa hips. So upon inspection, there are no discoloration or hyperpigmentation on the patient's breast skin, as their skin remains uniform with the rest of the body. There are also no localized swelling or edema, and I also didn't observe any retraction or skin dimpling. And for the as upon inspected also, the size is also symmetrical bilaterally, and also its shape. And then after that, I have to inspect the nipple and also the areole for its position, color, and for the areole surface, I have to inspect for any masses or lesions, and for the nipples, I have to inspect for any discharge. So upon inspection po of the areole and the nipple, the color appears to be smooth. The areole and the nipple appears to be smooth and symmetrical in terms of color. And on the areole surface, there are also no masses or lesions found. And as for the nipples, the nipple of the patient is everted and also symmetrical without any observed discharge. And then after that, I have to palpate the subclavicular, the supraclavicular, and also the axillary using the finger pads of my fingertips. So for that, I have to So, sir, next po natin gagawin is I'll be palpating po sa may taas po ng collarbone nyo, sa baba po ng collarbone nyo, and sa gilid po na breast area. And also sa ilalim din po ng hip. So, taas natin. Magpapalpit ng foxen. May sakit po ba?
Wala.
Dito po.
Wala.
Dito po sa area.
Wala.
And dito po.
Wala.
And dito po.
Wala naman.
Sir, so next tayo, sir. May sakit po ba dito, sir?
Wala.
And dito po.
Wala naman.
Dito po.
Wala.
May sakit natin, sir. May sakit dito, sir. Dito po.
Wala rin.
Dito siya may sakit.
Wala.
So, upon palpation of the patient's lymph nodes, there are no palpable lymph nodes, and it was also non-tender, and I've also didn't palpated any localized swelling or edema. And then after that, I have to palpate the breast for any tenderness, masses, and any reported pain for the patient. So, sir, next naman, sir, is yung breast area. So for I have to assist the patient in a supine position. To better flatten out the breast against their chest wall to facilitate better palpation. Sir, mag-palpate na. Sir, may sakit? Sir, may sakit? Sir, may sakit? Dito, sir, may sakit? So if the patient has any reported mass, I have first to palpate the normal breast before proceeding to the breast with mass to have a baseline data to use as a comparison. So for the patient, there are no non-palpable mass around the area. It is also non-tender as the patient didn't complain any pain, and there are also no localized swelling around the area or edema. After that, I have to inspect the areole and nipple for any discharge. And if there's any discharge, I have to note its consistency and color. So sir, ikaw compress ko lang po ng slight yung nipple niya for if to look for any discharge or anything. So there are no swelling on the areole of the patient. There are also no observed discharge around the area. And then after the assessment, if the patient wants to, I have to teach them self-examination on how to do their own breast assessment. And then last is to document the findings. So sir, tapos na po tayo sa assessment. Thank you so much po for cooperation, and I'll be just sending this po to your physician and we'll immediately call you po pag may result. Thank you sir.